Thank you very much for inviting us to showcase our technology in this event. Thank you especially to all the RaDAR consortium, but especially to Aquas and Institut Català d'Oncologia, our close partners in our experience. In 1879, Charles Chamberlain developed the first modern autoclave, revolutionizing medical sterilization. Before its implementation, surgical infection rates were over 40%. Today, thanks to technologies such as the autoclave and other strategies that have been implemented around these technologies, have fallen around 2 to 3% on clean surgeries nowadays. This advancement not only saves millions of lives, but also laid the foundations of a culture of safety that we continue to build today. Just as the autoclave transformed medical practice, we are now facing another technological opportunity: the use of rapid PCR for screening at-risk patients on hospital admission, being it the basis of an infection control strategy through the use of diagnostic testing. Specifically, the symptomatic screening of carriers of carbapenems-producing Enterobacteriales, MRSA, and vancomycin-resistant Enterococcus. The objective of my quick presentation today is to show you how rapid PCR has been embedded as part of RaDAR project to reinforce patient safety through the reduction of the AMR spread in hospitals. We are Cepheid. Cepheid is a worldwide company with over 6,000 global employees, 1,400 employees in EMEA, and reach patients over 180 countries. Our portfolio has 31 rapid PCR tests for virus and bacteria identification through our what we call our GeneXpert system. The GeneXpert platform is a highly scalable and extremely easy to use platform, delivering the highest precision of PCR while simplifying the on-hands processing. All starts with the sample collection. You can see the swab. The sample goes into the cartridge goes into the system, and around 1 hour later, the magic is done. The result is ready for the clinical assessment. These systems are different sized according to the setting that clinically are best localized. You can see at the lower part on the right, the hospital lab systems. We can also place them in emergency departments, in physician offices, in primary care, in sexual health clinics, checkpoints, in nursing homes or intermediate care facilities, and also even in public health offices or pharmacies, depending on the country that we are talking about. We have done that. What was the role of the GeneXpert on the RaDAR tender? For this project at the Institut Català d'Oncologia, Cepheid provided the GeneXpert rapid PCR solution to detect, as I said before, 3 targets: the carbapenems-resistant Enterobacteriales, the methicillin-resistant Staphylococcus aureus, and the vancomycin-resistant Enterococcus. These 3 pathogens are recognized by the CDC as a major AMR threat and are included in the CDC February 2025 call for action to member states. They are primarily transmitted in hospitals and other inpatient care environments. These 3 tests enable CPE MRSA and various screening for, in this case, in this project, oncologic asymptomatic patients at risk of carrying this bacteria at admission, and help protect vulnerable patients themselves and also other vulnerable patients that can get in contact with them during their admission, preventing exposure and new colonization. What's the value for the patient and for the healthcare system? In 6 bullet points, we can say that an early detection prevents transmission. identifying carriers in high-risk patients, avoids new colonizations, and reduces asymptomatic spread in the hospital. It supports AMR control because it limits the transmission of resistant organisms and contributes to AMR containment efforts. So it optimizes antibiotic use, reduces unnecessary exposure to last-line antibiotics, and enables more targeted treatments. It protects antibiotic effectiveness and slows the development of resistance. It improves the overall patient safety in the hospital by decreasing healthcare-associated infections, as we said before, preventing outbreaks, because it's a preventive approach which prevents outbreaks. And it also drives system-level impact in Spain because it creates a strong synergy with the antimicrobial stewardship program, what we call PROA in Spain, improving the overall results on AMR reduction. This is interesting because while PROA, antimicrobial stewardship, reduces the wrong indication of antibiotics, in this case, we reduce the need of exposure of patients to antibiotics. So it's a synergy that less patients will be needing antibiotics and better antibiotics will be prescribed. And last slide. Our takeaways of the RaDAR value-based procurement project. It's very interesting for us. It was a real opportunity to sit at the table for innovation for first time that we did it in Spain. RaDAR gave us the opportunity to discuss directly how our technology could support public health priorities. The procurement focused on outcomes and not only on price. And that's also valuable for us because we are in a better position to show the value of our technology. The process helped connect our value proposition with real system needs and patient outcomes. We also valued very much the openness to listen and explore where innovation could add value through the market consultations that were very key for us to understand what was the need and to make us understand what were the capabilities of our technology. So we can reach until here, and we have this need. So then the match was possible thanks to this communication. This project is showing another interesting thing, which is it shows procurement as a policy driver. RaDAR shows how procurement can actively shape public health strategies, not just purchase products. And that's interesting because it helps healthcare policies to move forward. Healthcare policies move forward sometimes is a risk. Value-based procurement, this pilot project, is the risking innovation for buyers, and that's another good thing of it. Piloting is a structured framework that reduces the uncertainty before broader investment decisions are made by the different decision makers and the governments, national and regional level in Spain. But also, it can suppose a scalable model for Europe. This approach can be replicated to strengthen healthcare systems preparedness across different countries, supporting the very recent ECDC IPC guidelines that were published this month, implementation. So this is one tool that can support the implementation of these IPC guidelines. Thank you for your attention.